Good evening, my lovely students. This is Professor Jesica Abrams at Broward College Central campus. It is now summer session in 2016, and this video is being made hopefully to supplement the information that you were given in class regarding exercise 25, the endocrine system for BSC2086 Anatomy 2 lab. So as anybody who has watched my first attempt at making these sorts of videos, which was for the renal system, has probably already noticed, while I like to think that I'm pretty good at anatomy and physiology, technology isn't exactly one of my strong suits. So hopefully I've made a few adjustments and this one will be less jumpy and the picture clarity will be better, but at least you guys have access to the PowerPoints, so if it gets bad you can always try and follow along my words with your copy of the slides. So, what is the endocrine system? Well, it's made up of these organs and glands throughout your body that produce hormones. And what are hormones? They're chemical messengers, right? And what is the point of a messenger? Well, it's communication. So the endocrine system is like a communication system throughout the body. And we'll see that it works very closely with the nervous system, which makes sense, which you should have learned about in Anatomy 1, 2085. And the nervous system is another communication system. It's like the master communication system of the body. But the key difference is that the nervous system works with electrical impulses, right? That's how it sends its messages throughout the body. Whereas the endocrine system works with chemical messengers, and those are called hormones. So the major difference is going to be by the fact that when you send a nervous message, let's say you put your hand on a hot stove and the message is that you put your hand on a hot stove. What is the goal? It's to remove your hand from the hot stove, right? So you want that to happen very quickly, and it does. But it also doesn't last very long, and it doesn't need to, because once your hand has been removed, which hopefully you do pretty quickly, then you don't need that signal anymore. Whereas if you look at the endocrine system, what sorts of things does the endocrine system have a role in? Well, we can see here growth, metabolism, sexual development, and then of course homeostasis, which is the basis for pretty much everything in the body. And so those sorts of things like growth, for example, you wouldn't want to wake up tomorrow and be twice the size you were today. So they don't need to act as quickly. It's a slower process, but it also lasts longer in comparison to the nervous system processes, and it's because of these chemical messengers that they're using, as opposed to the electrical messengers. So once you have these glands that are going to make the hormones, where do the hormones go? Well, some of them go directly into the bloodstream, but others are going to first be dumped into the tissue fluid, which is also known as interstitial fluid, and that's going to carry them to the blood. And once they get to the blood, what is the function of blood? It's like the highway system of the body, right? So the blood and the blood vessels are going to travel around the body, and they're going to carry the hormones where they need to go. Are they going to get to places where they don't need to go? Sure, all the time. So it's really, really important, probably the most important thing to get out of this lecture, to note that different glands have very specific receptors on the cell surfaces. And that is very, very important, because if you put hormone, let's say growth hormone, all over the place, if it traveled in the blood and it touched absolutely everything that it touched would grow, right? But we don't want that to happen. We want it to only go to the thing that we want to grow that day. So whatever the target of that particular hormone is, only the glands that it's going to affect are going to have these very specific target cell receptors, such that the hormone will be able to work or exert its effects on that particular organ. So some of the specifics, the pineal gland is found where? It's found in the brain. It's this little thing right here. And it has one hormone that it secretes called melatonin, which you can actually buy at Publix or at the health food store. It was named melatonin on some ancient word that meant darkness, and it's often called the hormone of darkness. because if you've ever had to buy melatonin in the stores or if you've ever seen it advertised, it's sold to regulate your sleep. It's to help you sleep, right? And that's exactly what the natural melatonin is supposed to do as well. So it regulates something called the circadian rhythm, which is basically your body's innate ability to determine, okay, it's light outside, it's dark outside, it's nighttime, it's daytime, I should be sleeping right now, I should be awake, that kind of thing. So if you have a defect in this gland or its ability to secrete melatonin, then you have something called SAD. And SAD is an acronym that stands for Seasonal Affective Disorder. And it's not so common in South Florida. Why? Because it's sunny all the time here. And it pretty much always feels like summer. But in places like New Hampshire, where I'm from, or northern Minnesota, where I lived for a little while, it can get dark and cold for long periods of time. And this affects some people much more so than others, and not only in a psychological level, but a physiological level too. It makes it really difficult for them to regulate their sleep, and they become insomniacs, and they become very depressed and anxious, and the treatment for it is, like you see in these pictures, artificial sunlight. So they wear the hat, or they put this sort of bench light up over their workspace during the day, and that's supposed to signal to the pineal gland that it's daytime. And they turn it off at night, and so hopefully your brain realizes, okay, this is the correct cycle that I should be on. The hypothalamus is a very important gland. It's also found in the brain. It's in the midbrain, so it's right here. And the very, very important function of the hypothalamus is that it links the nervous system to the endocrine system via the pituitary gland. And the pituitary gland is also called the master gland, and it secretes a whole bunch of stuff. We'll see in a minute that the hypothalamus does secrete some things, but I can't impress this enough that this is very, very important, that it links the nervous system to the endocrine system, because like we said, the nervous system and the endocrine system have to work together, right? The nervous system is the ultimate boss, and it very quickly tells you, okay, you need to do this, but then the endocrine system comes in slower, but it lasts longer and says, okay, I need to make a plan, I need to, have this person's sexual development last for years and years and regulate the amount of hormone that is being contributed to that role. So, again, links nervous system to endocrine system via the pituitary gland. The fact that it's a gland suggests that it also secretes stuff, which it does. Specifically, the neurohormones are the class of things that it secretes. We're not going to talk about them in detail, though you might have to list some for the lecture. But the overall function of these different neurohormones is that they stimulate or inhibit the release of the pituitary hormones. So like we said, the pituitary, which we'll talk more about in a minute, is the master gland. It has lots of different chemical messengers that it secretes, and this is not only linking these two systems via the master gland, but it's also controlling the master gland by releasing these things that either say, hey guy, make some more of this, or hey guy, stop making this altogether. So if you're dysfunctional in the hypothalamus or its ability to secrete these regulatory hormones, are you going to have a dysfunction? Yes. It's a rare one. It's not deadly. It's not that serious. Hypogonadism and loss of olfaction, which is the sense of smell, are the two symptoms. It's called Kalman syndrome. They have found actually this to be in a couple of women, one or two now, but it's mainly a disease that you'll find in men. Okay, so the pituitary gland is probably the biggest of the little things that you see hanging down from the brain. It's the one right here that, a lot of people think looks like other things, so it's easier for them to remember. It's divided into two. It comes down on the stalk, and then it's divided into two lobes at the bottom. There's the anterior, or the front part, pituitary, which is also called the adenohypophysis, and then there's the posterior pituitary, also called the neurohypophysis. And if you look at this picture, it's easy to see that one of them produces a lot more hormones than the other one. and that would be the anterior pituitary, right, or the adenohypophysis. And you can tell that by the fact that, one, it's larger, right, in size, but also if you look, it's kind of grainier than this one. So you can see all the little proteins being made and the pieces of hormone that are waiting to be released in there. So we said that the adenohypophysis secretes a whole bunch of different things, and here's the list. It secretes TSH, which stands for thyroid stimulating hormone, and what do you think that does? It stimulates the thyroid. It secretes GH, which is growth hormone, which is another one that does exactly what you think it does. It promotes growth. PRL stands for prolactin, and if you think of lactation is milk production, right? So this is going to have a role in breastfeeding. FSH is follicle stimulating hormone. Where do you find follicles? Yes, it's true, you find them in hair, but another place that you find follicles is in the reproductive system, so in the testes and the ovaries. They're considered follicles. So FSH plays an important role in reproduction and the menstrual cycle. So if you stimulate those follicles, they're going to produce eggs or sperm. LH stands for luteinizing hormone, and it stimulates in women the production of progesterone and in men the production of testosterone. So this also is going to play a role in secondary sex characteristic development and reproduction and things like that. ACTH is adrenocortical thyroid hormone. So this one it controls the production of the hormones in the adrenal glands, which we'll talk about. This is just a mnemonic to remember the adenohypophysis hormones. Thyroids grow proud fish like A classes. You can laugh at that and not use it, or use it. It's up to you. Make up your own way of remembering them. The neurohypophysis only secretes 2. Adios is a way to remember which 2 it is. But they're both very, very important ones. So ADH stands for antidiuretic hormone, and that's the one that keeps you from peeing. It stimulates reabsorption or retention of water by the kidneys to make sure that you don't, get rid of or pee out all the water in your body. This is very important. It's also what gets shut off by alcohol when you drink too much. And then you break the seal and, you pee a lot. Oxytocin is something that stimulates muscle contractions, and specifically in the sex organs, muscle contractions. So the role that it plays in men is always positive. It only controls orgasm in men. In women, we have a complicated relationship with oxytocin because while it does do the nice thing of controlling our orgasms as well, it also has a role in menstrual cramps and in labor and in the flowing of breast milk out of our breasts. So where is your thyroid located? It is here, sort of in your throat. And I point this out and emphasize it because thyroid sounds like thymus, which is another one that we're talking about, and they're commonly confused, but they're not the same thing. So the thyroid looks like 2 masses with kind of a bridge in between, and the 2 on the other side that are lateral are called lobes, and the thing that connects them in the middle is called the isthmus. And this is the gross anatomy of the thyroid. If you look at the microscopic anatomy, or the histology under the microscope, you'll see that they have follicles, and the follicles are made up of follicle cells, right, surrounding a colloid, which is that matrix stuff that you see in between here. And then if you're not part of the follicle, you're next to the follicle. We call you parafollicular cells because para means next to, so you're next to the follicle. So what does your thyroid do for you? Well, it secretes some very important hormones. For our purposes, we're going to consider that T3 and T4 do the same thing, and they play a very important role in increasing metabolism. So you'll see people that have thyroid disorders. Either you can have a hypothyroid where you don't have enough thyroid hormone, or hyperthyroid where you have too much. And the way they present as a patient is if they're really hyper, so if they have too much thyroid hormone, then what would that look like? Well, you're increasing the metabolic rates, right? So these people are going to be really skinny. They're going to be hot all the time. They're going to be kind of twitchy and show like ADHD kind of symptoms. Whereas people who are hypothyroid, they don't have enough thyroid hormone, therefore their basal metabolic rates are going to be too low. So these people tend to be large, overweight people, and they also tend to be very resistant to diet and exercise. In other words, they are very tired a lot because of their decreased metabolism, and so they have a hard time dieting and exercising because they always feel like they're tired and they need to eat and sit down. But also, even when they do diet and exercise, these will be the sorts of people that tell you, oh, I tried that diet and exercising, and my friend did the exact same thing. She lost a bunch of weight. I didn't. That's a red flag that they need to have their thyroid checked. So their thyroid hormones play a big role in metabolism. The other hormone that they secrete is calcitonin, and calcitonin plays a role in blood calcium regulation. So this is the one that decreases blood calcium regulation, but just like anything else, calcium has to be tightly regulated in the blood for that wonderful thing we call homeostasis, where too much of a good thing is a bad thing. So we're going to talk in a minute here about the hormone that antagonizes calcitonin. So this is the thyroid gland, and where would you find the parathyroid glands? Well, next to the thyroid, right? So they kind of look like they're inside of the thyroid because the thyroid's kind of squishy, so they kind of get sucked up, but really they're next to, and you have two on either side. And they only secrete one thing called PTH, very cleverly named parathyroid hormone. And what does it do? It antagonizes calcitonin. So first of all, what does antagonism mean? Well, if you're the good guy in a movie, the bad guy is your antagonist. And if you're the bad guy in a movie, the good guy is your antagonist. So they work together to do the opposite things. And calcitonin, we just said, does what? It decreases blood calcium levels, right? So parathyroid hormone is going to do what? It's going to increase blood calcium levels. So can we say one of these is a good thing and one of these is a bad thing? No, we can't, right? Because homeostasis tells us that if it gets high under certain circumstances, we're going to want to bring it down. If it gets too low under certain circumstances, we're going to raise it. So these guys work together to achieve that goal. So where was your thyroid? It was in your throat, right? Where is your thymus? It's on top of your heart. So here's the thyroid. Here's the thymus. They look very similar, but one's up higher than the other. The thymus produces one hormone. It's called thymosin, and it causes maturation of T cells. If you've never had any exposure to immunology, T cells are very important in the immune system response. So thymus, thymosin, T cells, immunity. The adrenal glands are a little bit complicated, so they do a lot of stuff for us. So we subdivide them, first of all, into the outer part and the inner part. And the outer part is called the cortex, and the inner part is called the medulla. So the medulla has a function of secreting epinephrine and norepinephrine, which basically do the same thing. And you might remember them, they're also called adrenaline and noradrenaline. You might remember those from Anatomy 1 when we talked about the sympathetic nervous system, the fight or flight response. Those play a very important role in that. The outer cortex is subdivided into 3 layers. So the outer part is the zona glomerulosa, and that secretes mineral corticoids. So those are cortical steroids. You might have heard of cortisol. You may have even purchased it from the store, or cortisone. And it is used for various things, but one of the things is reducing inflammation. And we'll see in a minute why that is, because it's a synthetic version of our natural glucocorticoid steroid hormones. So specifically, mineral corticoids are important in water and electrolyte balance, so back to homeostasis, and if you remember all the cell stuff from Anatomy 1 of how you put a cell in a pure water environment and it didn't like that very much, and you put it in a really salty environment, it didn't like that very much either. And that's why we can't drink salt water, and that's why you can't put pure water in a patient's IV bag because you'll kill him or her. It has to be this perfect concentration of saline due to the fact that waters and electrolytes have to be balanced in our body at all times. So that's very important. The middle layer of the outer cortex is called the zona circulata. It secretes glucocorticoids, which is the other type of corticosteroid. And these are going to play a role in, first of all, gluconeogenesis, which if you break it down, gluco means sugar, neo means new, genesis is like generate. So you're making new sugars. And it's going to do the opposite thing for protein and fat. It's going to catabolize them. So catabolism is the breakdown. Metabolism is the sum of all the processes of your body, all the chemical processes, and it has two major components, anabolism and catabolism. And I always remember them as Anna builds blocks and her cat knocks them down. So when you're using parts to build bigger things like proteins, then that would be anabolism. In this case, you're breaking down proteins and fat into little things that you can store them for later. So that's catabolism. And then, like I said, reducing inflammation is another big role that these glucocorticoids have, and that's why the cortisol shots and that you can get from the doctor and the cortisone that you can buy for, an itchy rash at the store will work to reduce inflammation, because those are just synthetic versions of our natural hormones. So the deepest level of the outer cortex is called the zona reticularis, and it also produces some glucocorticoids, although the major producer is that middle layer, and the major thing that this layer does is production of sex hormones. So androgens and estrogens are the sex hormones. So if you're a male, your gonads are your testes. They are responsible for production of testosterone, and testosterone is responsible for the production of secondary sex characteristics in males. They are equally important in producing their own substance called inhibin, and if you think about it, the word inhibin sounds like inhibit, right? And that's exactly what it does. It tells it when to stop, because too much testosterone, just like anything else, is a bad thing. So when you have enough of it, you need a signal to say, hey, stop making this, and that's what inhibin does for you. And specifically, these things are produced in the interstitial cells between the seminiferous tubules. In women, the gonads are our ovaries. We produce estrogen and progesterone. Everything with us is generally more complicated. We produce two things instead of one. And that's because not only do we have to regulate our secondary sex characteristics, but we have the babies, right? So we have to regulate the menstrual cycle. We have to worry about the maturation of our eggs and the baby and everything like that. But if you'll notice, we also produce what? Inhibin. Because it's just as important for us as it is for them that once you are too much progesterone or too much estrogen, you have to find a way to shut that off, and that's what inhibin does for us. So the pancreas is probably the most famous gland, or at least the one that everybody knows about, and it's particularly special because it's the only organ that has both an exocrine and an endocrine function. And we're going to skip the exocrine function for now, because we'll talk about that when we get to the digestive system, and just talk about its endocrine system for now. So there are three major cell types that contribute to its endocrine functions within the pancreas. And if you look at the slides of the pancreas, you'll see these islets of Langerhans, and it's like a little island of cells. And it contains two cell types, alpha cells and beta cells. But we said there are three cell types that are important for its endocrine function, right? So if you theoretically had this slide on your practical or test or something like that, then you would be able to narrow it down if it pointed to a cell that was in the islet of Langerhans, which is pretty easy to figure out where that is. then it's got to be either alpha or a beta cell, right? Whereas if it's pointing outside of the cell and asking you what cell this is, it's got to be a delta cell. So what do these cells do? Well, the beta cells are the most famous and arguably the most important, and they produce insulin, and insulin lowers blood glucose. By antagonistic pair, their friends are alpha cells, and alpha cells produce something called glucagon, which converts glycogen to glucose, which increases blood glucose. So again, they're antagonistic to each other. They are able to lower blood glucose and raise blood glucose, and these are both equally important in day-to-day life as well as in treating disorders such as diabetes and low blood sugar with other causes. If you have a patient that has low blood sugar, what would you use to treat them? Well, you wouldn't use insulin, right? Because that would make it even lower. You would want to use glucagon. And if you, vice versa, had a patient that was really high sugar, then you would try insulin to be able to lower their sugar. Delta cells are important that they secrete this thing called somatostatin. Somato means body, statin means static, so to stay the same. So what this does, it inhibits both insulin and glucagon, and it's kind of like the reset button. These guys are supposed to work together to make sure that the levels stay correct of glucose in the blood, and this comes along and says, okay, you're doing a bad job of it, so I'm going to inhibit both of you and we're going to start over again. So then I just want to close by talking a little bit about diabetes, because it's so important. It is the #1 preventable disease in America, as obesity has become the #1 preventable condition, medical condition in the United States today. It was smoking for a long time in COPD, but the smoking numbers have gone down because it's no longer cool to smoke. And there's all this education and empowerment of people to quit smoking or to not start smoking, whereas the obesity epidemic is on the rise and the numbers just keep getting higher. So diabetes mellitus, there is another kind of diabetes, which is diabetes insipidus, but that's a brain injury and that's much rarer. The more common one, when you hear diabetes, it usually means diabetes mellitus, or DM. Comes in two varieties, type 1, which is IDDM, and type 2, which is NIDDM, and that stands for insulin-dependent diabetes mellitus versus non-insulin-dependent diabetes mellitus. So what do these patients look like? Well, this type has a rapid onset, often in childhood, and it's caused by antibodies that destroy the beta cells, which are the ones that make insulin. It only accounts, however, for about 10 to 15% of diabetics in general. And injections is meant to indicate that they have to be given injections of insulin, which is why they are insulin-dependent diabetics. So what do these patients look like? Well, they tend to be really, really small, right? Because how do you get type 1 diabetes? You're born with it. So from the get-go, these patients are unable to properly metabolize and store the sugar that they're intaking, so they're not able to develop properly and have a hard time putting on weight. So these patients tend to be very, very skinny. The other side to that is type 2, which has a more gradual onset. We're seeing this sadly in younger and younger patients, but for the most part it's still usually middle-aged patients that you'll see this on, or at the very least adults. And the cause of this is diet and exercise, poor diet and exercise. And so this is the one that's linked with obesity. It accounts for 85 to 90% of cases. So I wanted to point out that because this one that you're born with is caused by an antibody, so your immune system, it's an autoimmune disease, and it's caused by your immune system destroying the cells that produce insulin, and what is happening is that you don't have enough insulin. So it should make sense to you that how would you treat this? Well, you would treat it with giving insulin, right? Whereas this one what is happening when your diet is poor and your exercise is poor for a long time is that your body is either losing insulin receptors or it's becoming unresponsive to the insulin. So why wouldn't giving these guys insulin help? Well, because the problem isn't that they don't have it, it's the problem that their body is become immune to the insulin. So if you give them insulin, it's not going to hurt them, but it's not going to help them either. So since this one is caused by diet, are there fancy pills out there now that cost more money and have scarier side effects than regular insulin does that can treat this? Yes. But generally the first line of treatment for this, because the cause is what it is for the patient to lose weight. And that's absolutely the best treatment for type 2 diabetics. I also wanted to point out that hyperinsulinemia is a problem, and it can lead to shock. Why? Because if you have too much insulin, what does insulin do? It lowers blood sugar, right? So if you have too much lowering of the blood sugar, basically you're having this ginormous drop in blood sugar all of a sudden, and it's at the very least going to cause somebody to pass out and hit the ground, but you could even go into shock depending on how low it gets. I made the point to say how important it is to realize that out of the two possibilities of having blood sugar that's too high in your patient and having blood sugar that's too low, neither one is good, please don't misunderstand, but it would take a lot longer for a patient to die from high blood sugar than it would for them to die of low blood sugar. Your brain, which is the boss of everything in your body and controls, those fun things like having your heart to beat and your lungs to breathe, needs glucose in large quantities to function on a daily basis. So when it starts running out, it will try to make you unconscious so that it can shuttle all of the glucose from all your other organs and steal it all for itself. But if it is unable to do that, it can very rapidly lead to death or coma. So that's the situation that you're going to see much more commonly, and it occurs when people either forget to eat or for extended periods of time, or they don't eat enough and they take too much insulin and it drops their blood sugar too much. Alright, so that's it for this lecture. I am going to try and break it into pieces and upload it to YouTube and send you guys the link. So let me know how it works out for you, if it was helpful, and if it's decent quality and you can see it, and if you liked it and I should try and make more. Otherwise, have a great night. Good luck studying. Let me know if you have any questions. Alright, take care. Bye.